Hello and welcome to Gray Matter, your one stop to all your exam needs. Today we are going to discuss the domains against which you will be marked in the PLAB 2 or UKMLA exam. So let's go to it. The domains against which you will be marked in the UKMLA or PLAB 2 exam. So there are three domains that the GMC is looking for that they're going to mark you against. As you know that there are a total of 16 stations, excluding the two rest stations. And out of the 16 station, each station carries 12 marks each. So 12 mark each station. The 12 marks are divided equally in three different domains that the GMC are looking for. That's number one domain is is the data gathering. So what does data gathering means? Data gathering is as important as all the rest of the two domains, since all of them carry equal marks, which is 4 marks each. So it entails your history taking, your physical examination, your practical procedures, and the investigations that lead to a diagnosis. Now you need to remember that the diagnosis that the GMC is looking for is a provisional diagnosis. So this is not the definitive diagnosis, the exact diagnosis that they're looking for. They're looking for a diagnosis that is, in the ballpark. So in the ballpark, the diagnosis has to be efficient. It has to be supported by your history, by your examination, and your management. It does not need to be, just out in the air. It needs to be supported by facts. So when you are in going to your exam, when you're outside the center, the lead examiner is going to brief you, and he's also going to tell you this exact same thing, that they are not looking for the consultant level diagnosis. They are looking for a provisional diagnosis that are going to be supported by your history and examination and the procedures that you're going to do. So this entails the data gathering part. So all of the stuff that leads to a diagnosis. It does not include the diagnosis. It is all the things that you do, the history that you take, the examination that you take, and the procedures and the investigations that leads to a diagnosis that is included in the data gathering part. So the second domain is the clinical management and skills. So the clinical management and skills, it includes formulating a diagnosis and a management plan. So this includes two things. One, the diagnosis that you have made, the provisional diagnosis that you have made, and the management according to the diagnosis. The management that you have to explain to the patient, that is included in the clinical management and skills, and this also concludes 4 marks. And the last but not the least is the interpersonal skills, or IPS. Now, according to my humble opinion, this is the most important part in the PLAB 2. The IPS, the interpersonal skills, it does not depend on your clinical knowledge. It does not depend on the bookish knowledge. It entirely depends on your character, on your acting skills. So this can be broken down into your acting skills. This is not something that you can memorize from a book. This is not something that you can, absorb from your teachers, from your professors. This is something that you have to entail within your personality, that you have to act according to the situation that is given. So it includes how you approach the station, whether you whether you establish a rapport with the patient, whether you address his concerns, how to use open and closed questioning, meaning that open questions you can simply ask the patient the symptoms that they are observing or experiencing, and the closed questioning that includes simple yes or no questions, and the ethical principles that you demonstrate. So this concludes the IPS section of the domains that the GMC are gonna mark you on. So in my opinion, the IPS is the easiest and the hardest domain that you have to master. Is the easiest in the sense that it does not require any bookish knowledge. It does not require you to memorize anything. It's simply how you act according to the situation. Let me give you an example. For example, there is an angry patient that is coming to you, and remember, the patients there are professional actors, so they will act to be angry. So, how you counter that situation, how you deal with the patient, how you, calm down the patient, calm down the situation, and get the relevant facts from the patient, that is included in your IPS. Another example is a grieving patient, or some patient that you have to break a bad news to. So how you break the bad news? Do you break the bad news in layers? Do you take breaks? Is your voice low? Are you empathetic? Are you understanding the patient's difficult situation? So you have to act towards the patient like this. The examiner is going to be watching each and everything. He's There isn't going to be any table between you or the patient. It's simply going to be two chairs. One chair you're going to be sitting, and a chair in front of you will be the patient, and right next to the patient will be the examiner. So he's going to be looking at your body language. Are you nervous? Are you fidgeting your legs or your arms? So he's going to be looking at your body language. So you need to remain calm. You need to remain confident. Your body needs to display that you are the boss, and your body language is the first part that depicts the interpersonal skills. So hope this video helps, and please like, share, and subscribe to the channel, and happy preparations.